Welcome to the What About Rural Health podcast, a place where research, policy, and real life stories come together to ask the critical question: what about the communities too often left behind? I am Chinasa, a development and global health policy strategist. And for me, this work is personal. From the village health workers struggling with limited supplies to the mothers working miles for care, their stories shape the policies we need. Join me as we uncover challenges, spotlight innovations, and amplify the voices of those at the heart of rural health systems. Because every community matters, and it is time the world listens. Hello and welcome. You are listening to the podcast that asks the question too many people forget: what about rural health? I am your host, Chinasa Imo, and together we are uncovering the stories, challenges, and innovations shaping healthcare in overlooked communities. Rural health financing conversation often focus on infrastructure, workforce shortage, or insurance coverage, but they rarely do discuss other fundamental questions like: who is health financing designed for? Who is it currently serving well? And who is it not? This podcast series, Rethinking Rural Health Financing Investment, Challenges and Opportunities, is interrogating these questions. We are looking beyond the line items and the budgets, and we are now asking the question: how health financing discussions shape access, dignity, and outcomes, especially for people living at the margins of the healthcare system, such as the deaf and disabled people in our communities. Across this series, we will explore how financial decisions influence who gets care, how care is delivered, and whose needs are prioritized, especially in rural and hard to reach communities. And today's episode is titled Excluded Voices: Financing Care for Deaf and Disabled Communities in Rural Health Systems. It highlights disability access because it exposes a fundamental truth. When system fails to budget for access, the design becomes exclusionary. And for people with different abilities, the cost of exclusion is deeply consequential. In rethinking rural health financing through the lens of deaf communities, we are talking about language access, community barriers, and the hidden costs that individuals and their families absorb when systems don't budget for their inclusion. But before I introduce you to my guest today, let us take a quick break. If you are enjoying this conversation, don't forget to subscribe to What About Rural Health on all our podcasting streaming platforms. We are on Spotify, Amazon Music, Apple Podcasts, Listen Now, and so on. And yes, we are on YouTube as well. Your support means a lot to us. Please like, leave a comment, share, and most importantly, drop us a review. It helps others discover this important conversation. All right, welcome back to the episode. You are still listening to What About Rural Health with Chinasa Imo. Without much ado, let me introduce you to my guests. Joining me in the studio today is Grace Lester. Grace is a clinician, an advocate for the deaf community, and a researcher whose work sits at the intersection of health, justice, and human rights. She works closely with deaf individuals as they navigate healthcare systems, courtroom, and the carceral institution, a place where access to healthcare for disabled individuals becomes challenging when they are unable to receive tailored services. Grace is left deafened, and her advocacy is rooted in deaf liberation. Her work focuses in confronting structural violence against deaf people in the prison system through research, writing, and public education. She's also writing a book on the experience of deaf communities in prison. And this is important because in those settings, lack of access is not just about inconveniences. They can be life altering experience. We will take some time in this conversation to sit with that work and discuss what this means and what it reveals in our system. She is also a primary organizer in Deaf Relief Gaza, a mutual aid network working to ensure Deaf Gazan can access life saving care and services in the midst of ongoing violence and displacement. I want us to understand that today's conversation is not only about highlighting the healthcare needs of disabled people, but also how health financing priority delineates who we consider essential versus who we consider optional in our collective value system as a society, and who gets left out in that trajectory. I'm really grateful to have you here for this conversation, Grace.
I'm really grateful to be here. I'm so looking forward to it.
Thank you so much. And to our listeners, I want you to think about your own community. What does access actually look like where you live? Who bears the cost when systems are not designed for inclusion? And who get left out when financing decisions are made without differently abled community people on the decision table? So think about that while I zoom back and discuss with Grace. So, Grace, I'm so happy to have you here. But before we dive in, I am getting to all of this conversation around financing, policies, and systems. I want to start with you. When you think about the work you do with deaf communities, especially in healthcare settings, what moment or experience kept you going?
I think I've really thought about this question before we came in, and there's a lot of moments that came to my mind before I settled on, I think, one of the most profound moments that I've had early on when I was learning more about deaf people's experiences within the prison system. I was talking to a man who he was incarcerated for like 23 years. And he was deaf in both ears. He used cochlear implants, so he had some hearing assistive devices that ended up being taken away from him by correctional officers while he was incarcerated. Really had very few avenues to communication throughout multiple decades of being incarcerated. And in the course of our conversation, I was asking him about self advocacy and how he had his rights met. And he didn't know what the word rights meant. Like, he had never heard that word before. And I think that sits at so much of the intersection of so many different system failures, right? Like when you have deaf people who don't have enough access to language to have vocabulary around what does it mean to be a civic participant? What does it mean to advocate for yourself? These different things. And then put into a system where you are, okay, you might have a right, but you're the one who has to fight for that right, et cetera, et cetera. Um, and I think that it's such a relevant moment because you don't have to be a person who's advocating in a prison to be able to say, okay, you're an educator or you're a family member of a deaf person or you could be a language. There's so many different ways that you can intervene at any moment to make sure that deaf people are more holistically included. And at that point, are not going to get to a point where they're in a system where they're supposed to, be advocating for a right that they don't even know that they have to begin with. So that's one of my big moments of, wow, people have a lot of moments to intervene. Yeah.
Thank you so much for your response. And when you shared that, like the story of your encounter with this person that is deaf in both ears, and I wanted to make sure that we get to, like, I get to pivot this question from an individual to ask you, at what point did you realize that this is not just an individual encounter? Like you can have pockets of this experience with different individual, but having that and putting them together, it becomes a structural issue. At what point did you realize, oh, this is not just me helping one person, I need to look at it, like step back and bring in a structural lens to look at it holistically.
I think that, so when I was young, I had a loved one who was incarcerated, right? And so that was my first exposure to the system itself. And I'm late deafened as well. So I was born hearing and then I lost my hearing later in life. I was 13 when I started losing my hearing, and then I was 14 when my loved one was incarcerated, right? So I'm navigating my own deafness while at the same time navigating this person who has been removed from our community and put into a carceral space, and reckoning with both of those things at the same time. And I do remember exactly, these years of me trying to have enough access to be able to communicate and sustain a relationship with my loved one, when something as simple as, how do I make a phone call to this person? We can't just meet up in person. It's something so simple that we don't think about as an audio call, but that's your lifeline to your community. And if you don't have an accessible means of communication, then that cuts off a relationship, right? And so I think that it took me a long time before I started to think, oh, if this is happening to us, it's happening to other people, right? And not only if it's happening to us, it's happening to other people, but if I'm the deaf person on the outside, what is that like for the deaf person on the inside? And I started looking more into the prison system is a tough one because it's really challenging to find information about what's going on in carceral spaces in the first
I
place.
agree with you on that one.
Really, really, and I believe that that's a very intentional mechanism of obscuring people from having outcry or obscuring people from being able to advocate or to intervene, right? And because there's, a policy that's going to look one way in a local jail compared to a policy that's going to look a different way in a state prison compared to how that's going to look on a federal level, what that's going to look like in an ICE institution. Like, they all look very differently. And as a result of that, it can be really hard for researchers to even get into every single facility and to ask the most basic question as, how many deaf people are incarcerated? What services are they getting? What services are they not getting, right? And the information that we currently have is what's published by the Federal Bureau of Prisons. And so clearly, when you are the system yourself and you're the one who's producing the information about it, right? Like, how accurate or reliable is that information going to be? That being said, my belief is that it's an underestimate. What they're publishing is that 1 in 10 people in state prisons and 1 in 16 in federal. Actually, I switched that up. 1 in 10 people in federal prisons and 1 in 16 in state prisons is deaf. That's a massive, massive number. And if you grapple with nothing other than the fact that 10% of the people within our carceral system, I should back up and say, when I'm using the word deaf, I'm using it across the spectrum. So when I say deaf, I'm not necessarily saying only culturally deaf people who were born and raised in the community, no ASL, are bilaterally deaf. I'm talking about anyone who can be impacted by autism, and autism is like violence and prejudice against deaf people, right? So if you're hard of hearing in one ear and that impacts your day-to-day life, you're a part of the deaf community. If you're deaf disabled, deaf blind, if you're culturally deaf, if you're not culturally deaf, you use sign language, you don't use sign language. I'm using that as an umbrella term, right? Because the way that deafness is experienced is as many deaf people as there are on the earth. So I think that pigeonholing it to a very particular group of people actually misses out on some of the,
I agree with you.
yeah, but 10%, like, that's with no further context. You can't say that's anything other than structural, and you can't say that's anything other than targeted. And I think that one of the really unique things about deaf identity is that you can cause a person to become deaf, right? So it's not even just, oh, it's 10% of who is coming in, right? It's could be, and we don't have the number of how many people are entering a jail or entering a prison, hearing and leaving it deafened. But we do have people are incarcerated for upwards of 30 years because of these three strikes policies or because of different, truth in sentencing policies. And people are in conditions that are unbelievable. I've read stories and interacted with people who became deaf incarcerated because they were abused by a correctional officer, and blunt force trauma to the head can cause deafness, or they had a bug infestation and that festered and festered and festered to the point that they had a fever, or to the point that they got an infection and that caused them to become deaf, right? So there's very clear tools within the system itself that cause people to become deaf and then withhold services for them being deaf to be able to thrive in that environment because it's so fundamentally dehumanizing.
Wow, that's a that's a lot to take in, and seriously, when you were mentioning all of these things and describing different ways that people come in contact with deafness, one thing struck me. All of these things were entangled within access to something, like, access to services that should be available, but it's not there, could be intentionally withheld or just structured within the system for it not to be made available. Or it could be an omission of planning around specific groups. It's easy for us to say we don't care about what happened to people behind bars, but they are human beings with different needs, irrespective of, however the justice system get them there, and they require certain services to function as human beings. And I'm hearing you say, besides the number of people who working with deaf disability, there are people who working wholesomely and worked out being deaf out of the implications of the experience and the trauma they go through in the system. And that brings me back to access. Like, when people talk about access for deaf communities, it's often framed as an ethical obligation, like somebody needs to do this. But from your experience, what does access reflect when it comes to, like, how are the system planning, financing, and prioritizing this access to care, or how a system withholding certain things so that people don't get access to it? Because it could, I mean, access, we can sit here and talk about a whole lot of things, but in your own experience, what does that look like?
I think it's a really relevant question. And I think that it's an important one because of the fact that so many people will say, I believe that deaf people should have access. I believe that, all people deserve these different supports and networks. And then when I ask, okay, so what are you going to do in your organization or in your scope to make sure that that happens? Most of the time, people say budgeting. I can't afford an interpreter, or I can't afford to figure out, paying for live captions or all of these different things, right? And it's challenging because people, even now, deaf centric agencies, grants are being cut left and right, right? People who are seeking out to provide services are saying we don't have the logistical means to do it. And I mean, even in, for example, some of the work that I do has been asking attorneys, okay, what's been your experience representing deaf clients? Or deaf clients, what has been your experience in civil courts and criminal courts, both having an attorney who's guiding you through the process? And there was one woman that I worked with who she looked for 9 months straight just to find a civil court divorce attorney who would accept her case because of the fact that she required an interpreter. And while we have the ADA, and the ADA is the Americans with Disabilities Act that says she's entitled to an interpreter, she's entitled to an interpreter in the court. So the court is going to provide one while they are there. But if she's going to have a private interaction with her attorney, which is a substantive amount of the preparation work that she needs to do to get ready to be in court, etc., the ADA doesn't cover that. And the ADA actually says that it's the lawyer who needs to pay for that. And so the lawyer is going to say, instead of saying, I don't want to, they're going to say, well, working with deaf people isn't my specialty. I want to make sure that she gets the best care. So I'm going to, you know what I mean? It's very sneaky.
This
It's such a
language.
loophole. Yeah. And I see that very often of people will not have the resources, not feel prepared, and so they'll say, well, really that's not our niche, right? We work with immigrants, but we don't work with deaf people, or we work with people who are re-entering society after they've been incarcerated, but we don't work with deaf people. Well, deaf people exist at every intersection of any demographic, right? So to just throw your hands back and say, oh, well, we don't know how to do that, or we don't have the money for it, um, like it or not, you're furthering the system of oppression that you are, seeking out to counter.
I agree with you. Like, talking about finance, and we think, oh, it's just about making provisions and the budgets to cover things. But what about like emotional provisions, professional provisions, like making sure that these things in every step of the way that we are accurately planning and providing for them beyond just money in the budget line that may or may not be used because of the contours of law. Like sometimes when people tell me where you are obligated to deliver these services to me, I would say, yes, I am obligated to deliver them to you, but I'm happy to look at the loopholes. And that is where I have seen like lawyers have their field day identifying loopholes and weaknesses in the language of the legal texts so that they would avoid doing that particular thing that they are obligated to. So we know this. And since we know this, why can't we be very realistic about what our services really look like, what assets really mean for people who have like double vulnerability in reaching these different things when they are seeking support and services. So this is a program for rural health and it's what about rural health? And I wanted to hear your perspective about this topic and how they show up or play out in rural underserved communities.
Hmm. I think a few of the biggest things that come to mind is that, so the deaf community, the signing deaf community, right? So people who are using ASL, BASL, different variations and dialects of sign language across the state, typically we pop up in hubs, right? So there's deaf schools or deaf educational programs, deaf training services, deaf jobs, and people will be, okay, there's a huge deaf community in New York City or there's a huge deaf community in DC, right? That's also where the most interpreters are going to be. And so when you are in a space that, I've seen people, okay, you get incarcerated, you don't get to just pick, oh, whatever the closest state prison or whatever the closest jail to your home. No, they're just going to put you in whatever facility they put you in. And that could have to do with security, that could have to do with many different reasons, right? But that could be, I mean, if you're in a state like Texas or California, oh, you could be a 14, 15-hour drive from your home community, right? And especially if you're in like a more Midwestern state where there's fewer interpreters to begin with, it's really hard to get an interpreter to, you can put out the thing, you can, I mean, let's assume, right, that you have correctional officers who are even willing and knowledgeable enough to say in the first place, we see this deaf person needs interpreters, we're going to make the effort to provide them interpreters, which already from the jump, that's making a really optimistic assumption. But let's say that they do. Seeking out, okay, first of all, the field of interpreters across the states is about 90% white women. And so, how many of them are going to be willing to work with people who are incarcerated in the first place with all of the stigma, with all of the bias, with all of the many layers there? But then, second of all, somebody who's going to say, I have to drive 3 hours to get to this assignment one way, and I don't get paid and compensated for that time, people are not going to take that position. And so it's really challenging to find. And I mean, in a state like Hawaii, right now they have 31 certified interpreters across the state, across the entire state. And so kids in schools, people at doctor's appointments, any place that you go that you need an interpreter, there's 31 to choose
In the
from
whole
in the
state.
whole entire state. And there's a couple of islands that don't have certified interpreters on them at all. So now somebody's going to have to hop a flight in order to go into a prison where they don't want to work in a prison in the first place, right? So there's these layers. There's also the layer of, in rural communities, there tends to be worse access to Wi-Fi. And the ways that a hearing person would make phone calls outside of a, carceral facility would be using just a normal auditory phone. The way that a deaf person would be is a video phone. And a video phone is not relying on a landline. Most of the time it's relying on Wi-Fi. So if you have patchy Wi-Fi, right, like I regularly call this person who's incarcerated here in Illinois, and our conversations, usually it will go about 2 seconds of clear video quality, followed by 2 seconds of really patchy, blurry, choppy, and then the next, and it's back and forth and back and forth and back and forth. So in those 2 seconds, okay, I'm trying to pick up, I maybe get like 6 words that you said. And then the next I'm like gonna guess. And then the next, and it's back and forth and back and forth. And it's like, not only his social support, but that's how he's calling his attorneys. And he's trying to get clemency, right? And so, how are you going to, even if you have an interpreter there, how are you going to be able to have a clear conversation and communicate what your needs are when you don't have good enough Wi-Fi to be able to make a phone call out, right? Or to receive a call. Um, so these very basic things that, it feels um, very strategic in the ways that, and people, my final thought on this is that, people will often, one, one prison may have a lot of services and like resources already set up in it. So they have the video phone available. They regularly schedule interpreters to come in, et cetera, et cetera. They've got, and that, sometimes the deaf people that I've talked to, it's like a play on words. They'll call it like deaf row, where like a lot of deaf people are housed together, right? Like they're all in this cell unit or this block together. Um, and they'll have more kind of consistent access to some of the resources that they need. I've seen several people who start to advocate and ask for more. Hey, you know what? We have interpreters, but they're not that good of interpreters. Or, I'm seeing that we need further resources on, we need announcements boards, we need these different things. When correctional officers see that kind of behavior and they don't like it, they can transfer you to a different prison and they can make up whatever, oh, you were having behavioral issues or you were being whatever different reason that they want to say. So then they transfer you to a more isolated prison, which, A, again, in a rural community, it's going to be harder for your family to come and visit you. And B, they can guarantee that you are completely linguistically isolated, right? So where before you maybe had 8 people in the prison who were also deaf who could sign with you, this next prison, you're the only deaf person there. You use sign language, you don't use your voice. And I've seen people who have said, oh, the correctional officers, they said that sign language was a gang language or it was a code language. So if I tried to sign with anyone, even a hearing person who didn't know sign language, but I was going to teach them the basics, we would be punished. We would all be punished. So then the hearing people would back off and they'd be like, I'm afraid of signing with you because I think I'm going to get reprimanded. So that's like not even the level of like, oh, now I'm linguistically isolated, but I am completely socially siloed to the point that nobody even wants to come around me because I'm afraid that if I do, I'll get punished. So it's really, really, really layered on the ways that they will use space in particular of like what unit you're in to define your quality of life and your access to services.
Thank you for your response. Like what I'm hearing from all of this thing that you try to lay out one after the other is that I think at the forefront, it will look like the systems are unintentionally designed for very specific kinds of people. And I would agree because the people who design the systems are usually very able bodied people and they think about themselves 90% of the time before they begin to factor in other kind of demography, right? But it is what they do in aftermath that worries me. Because it's one thing that, okay, when we designed the system, we weren't thinking about how do we include, say, people who have walking challenges, or how do we incorporate services for deaf people or blind people or whatever, services that needs to be added. But then you begin to see these scenarios play out in your centers, in your environment, in your care system, and you react in certain ways that reinforces your position as someone who don't care. Like it's like, yeah, there was an omission in incorporating you in the plan, but from the look of things, based on where I'm sitting and where you are sitting across me, I don't care. I don't give a hoot. You have to bend over and work with whatever systems that we give you rather than, oh, we need to expand our system a little bit to accommodate you. That is what I'm hearing. And then the second thing that you mentioned about rural care and distance is not just about the distance to travel or the distance to where you are removed and placed within the carceral system, but it's also about the entire definition of place in service delivery or place in service conceptualization. And I wanted to bring that question to you to ask, how does place change the experience of being deaf or having, other kinds of ability when seeking care? How does a place inform how much you can get access and how much or how little you eventually receive those services that you're looking for?
Mm-hmm. I mean, I think one of the first things that comes to mind has also been working with, because a misconception that a lot of people have is that sign language is this like universal thing, right? It's not. Every single country, different regions have very different sign languages. I mean, it can be a dialect or it could be a completely separate language. And what we see with a lot of deaf immigrants who maybe their native language is LSM, like Mexican Sign Language, or their native language. There was a recent case where a man was he was incarcerated in an ICE detention center for several months without an interpreter because they couldn't find an interpreter who knew his native sign language, right? Because he was an immigrant who was using not American Sign Language. What I've seen is a mix of, sometimes they'll just throw an ASL interpreter in there and be like, all right, based on what I know about sign language in general, I'm going to kind of try and guess what you're saying, which is like if you had like a spoken Greek interpreter and you were trying to like, it's completely
It's
absurd.
crazy.
Completely absurd, right? So even just thinking about space in context of how it develops your relationship to language, and then what services are available in your native language or in the language that you're most comfortable or fluent in. I've also seen, judges who will work with deaf immigrants and they will assume, oh, okay, maybe this person, we are not going to find a Mexican Sign Language interpreter, but I'll just write everything out in Spanish. Mexican Sign Language and written and spoken Spanish are not the same language, right? And so, again, thinking about the assumptions that are made about a person because of their relationship to space and language and these different things, and then finding the resources that are networked in. And there's an organization called Manos Unidos that has been doing a lot of really great work to counter situations like where this person is, waiting and waiting and waiting. And I think also understanding, right, for this person, the length of their detainment was completely correlated to the fact that there was no interpreter available. And I've seen that across the board, right? Maybe sometimes people have to take like a course that's necessary for release. You might have to take a victim awareness class, or you might have to take a mm, various different kinds of rehabilitation courses, right, to be able to be eligible for parole so that you can go home. I was talking to a man who said he was incarcerated alongside several other deaf people in his unit, and they had interpreters there, but the interpreters didn't use the same sign that the other people in his class were using. And so they just failed the class. And it was a year-long class, right? They failed the class 18 times in a row, which means that they were incarcerated for 18 years.
Wow.
Every single year, they were eligible for parole. They were eligible to go home and be back in their own communities. But because of a language failure, they were further incarcerated. And from my perspective, in a prison system that is exploitative of labor, that is all the while these men are incarcerated for 18 years longer than their original sentence, are, you know, producing whatever or laboring within the prison system in whatever different ways, right? Like, you're able to exploit a person on such a pervasive, long scale level, based on their proximity to do something as simple as, get the language access that they need, or have somebody stop and say, hey, you know what, maybe if this person has taken this course 18 times in a row, there's something wrong with the course that they're not getting and they're not grasping, and maybe we should readdress how that's working. But I know I jump around a lot, so always feel free to pop in and interrupt me when I'm straying off the course.
You are not. I mean, what you're discussing, like you're painting a cool picture, or rather say a clear picture of what's this means, like when you put place, space, language, and mix it up with disability, how that impacts different people. And reflecting backwards to, I mean, I am not in any way identifying as a disabled person, and I know what that experience feel like. The English that I speak, even though it's English, is different from British English. It's different from American English because it's Nigerian English. It's been indoctrinated into my local culture to the point where there's a version of English language that I speak that is Nigerian language. And that's my spoken identity, right? And when I interface that with American English, oftentimes people will be like, "Oh, you have an accent." It's a cool way to say we don't understand a jack of what you're saying. So now imagine, because I like to paint clear picture, if a very able human being who can use language, who speaks English and yet finds it difficult to use this English language in multiple spaces, can have this challenge, then how do we triple that effect to, say, someone who is barely catching up on English language and their predominant language is, say, Mexican language or Spanish language, and then the way we speak it is different from the way we write. Like, if you see the way I write, you'll be like, "Oh my God, that's so clear, that's so beautiful." Because I can sit and write and edit all of the beautiful things and throw in some punchline words that make it look like I sound smart. But that is not our everyday use of language. And that's intersect with, as you move from one place to another, it intersects with how much access you have with other people. Move a Chicagoan to Alaska, the language is already different. And if this person have impairment with hearing, now imagine what that means for an Alaskan service provider to provide services to that person. So I get what you're saying, and I resonated with that. And my follow-up question to you, because when you were talking, I'm like, okay, let's see what that looks like for those who are not even in the carceral system. But because of this brazen shortage of services and ability to get adaptive, assistance, do you see that causing like delays to seek care for people even when they need it, but they feel like, it's a waste of effort?
Absolutely. Yeah. And I mean, my work as a deaf therapist, right? Like I provide services in ASL, and I would say well upwards of 50% of my clients across the several years that I've been working, nearly, yeah, not all, but many, many of them have come and they've said either I've never had therapy because I could never find an ASL provider therapist, or I had several sessions with a hearing therapist and didn't feel like my needs were being met, or didn't feel like I could really express myself or be transparent or vulnerable or all of these different things. So often, in clinical school, right, we talk about the therapeutic alliance, the therapeutic alliance, the therapeutic alliance. When there's not a shared language or a shared cultural understanding, it can be really challenging to get past that basic level of, okay, I trust you enough to, engage with you in the first place. And I think it, I really appreciate what you shared. And I think that it's a very, kind of paralleling, okay, if these are my experiences, then how would that overlay into a deaf person's experience, or how would that overlay into an incarcerated person's experience, right? And like being able to, I think it's one of the main thoughts that I've had as a late deafened person, right, is like my early journey into deafness was not this like, I'm going to develop a cultural identity and I'm going to learn a language, right? It was meeting a lot of medical practitioners who looked at my body as something that needed to be fixed, right? As, oh, you're losing your hearing. That's so sad. And now there's something wrong with you and we need to change it and we need to fix it and we need to do all of these different things. I mean, I had surgery after surgery after surgery after surgery and had all of these different really renowned physicians who were on my team, and I never once had someone say, would you like the opportunity to meet with a deaf mentor, or would you like the opportunity to connect with a person who can teach you more about deaf culture, or hey, there's sign language classes that you could sign up for, and that would make it a lot easier than you having to wear these hearing aids that are painful for you, that you get really overstimulated when you wear them, right? So I think about exactly what you said of like, okay, even as a person who had consistent access to medical care in these kind of like top premier spaces, right? Like, was I given the tools to have pride in my identity or to have a smooth transition into deafness? Mm-mm, right? So, what is that going to look like for a person who becomes deaf while incarcerated, or becomes deaf and says, okay, then I want a deaf service provider, but those service providers only know ASL. And now, if I don't know ASL, then where do I start? Because these ASL classes that I've tried going to are only designed for hearing students, right? Like, there's all of these different layers about like, how do you transition smoothly? And I think that a lot of people just end up getting stuck, and they create their own ways of navigating the world without real systemic or structural support. Because often, if it does exist, there's not a network that will guide you into, okay, where this can happen for you, you know? So, yeah.
Thank you. Thank you for that response. And as you were mentioning that, what was moving through my mind is how does financing model consistently promote this culture of prioritization of what we think clients need, and how is it failing the people who really need it? And we live in a capitalist environment, right?
Yeah.
Even in mixed economy, we start off with we care about people, and then we still move into business
Yeah.
models.
Mm-hmm.
Okay, if only we can build the biggest technology that you just plug in there, and deaf people can begin to hear, and blind people can begin to see, without really connecting to the emotional well-being of these people and their need for belongingness, which is the first step for healing for anybody. I want my care team to walk up to me and ask me, how are you feeling today?
Yeah.
What would be the best course of treatment
Yeah.
that you think brings in your agency into the conversation? And these things are often left out in the discussion table. Is like, we look into your chart, we think that we do A, B, Z, D, Z. You will become a perfect human being and get mainstream back into the society. So how does these financial models, consistently fail us in the community? How does
Yeah.
that? Yeah.
Yeah. I mean, community, absolutely right. Because you think about like, wow, it's weird to almost go back and be like, really, like, it doesn't cost you anything financially to develop a relationship with a person, right? But those are not the ways that we're taught to think. It's this very like exactly what you said of this like checklist of, okay, I am going to work with a deaf person, so it's going to be A, B, C. I need to make sure that, and you have this very narrow perspective or understanding of who that person is going to be and how different their experience is going to be if they are a deaf blind person, if they are a deaf immigrant, if their native language is English versus if their native language is ASL versus if their native language is Brazilian Sign Language, right? Like all of these different factors of who they are as a person, and you don't stop and say, okay, how can we foster. I'm really trying to, like, I think what I initially started when I was, beginning my book, I remember thinking a lot, people aren't thinking about deaf people's experiences within the prison system, right? And across the board, there's a lot of neglect that's going on. And I've been researching this for years now, right? And over the years, my perspective has changed that, uh, again, 1 in 10, 1 in 16, it's not that you're not thinking about it. It's actually quite strategic to say, what is the easiest way that I could siphon a person off from their community? What is the easiest way that I can ensure continued community disruption is to separate this person out of their community. And then when I have them already isolated from broader community, to then cut off their capacity to communicate. And whether I've cut off their capacity to communicate because they're a signing deaf person who doesn't have anybody around them to sign and gets punished for signing, or a non-signing, non-culturally deaf person who doesn't have any resources to community engagement or to cultural acquisition. And I think that it's been a journey for me to understand that cultural deprivation is a form of violence. And it's a really effective means of prohibiting and barricading people from networking with one another, changing the status quo, having healed and thriving deaf communities on any level of society, whether that's within a carceral space, supporting people who are currently incarcerated, or whether that's a deaf community who is struggling to maintain, athletes programs or music and arts programs within their school because funding for deaf communities is getting cut left and right, or people are having to choose how they're going to use their SSDI very strategically, and so they don't want to, further their. So there's a lot of layers there.
Thank you very much for bringing that to that conversation. To everyone listening, do not forget to check out Grace's book when it is out in the market. Thank you for joining us today episode on What About Rural Health. If today's episode moved you, changed you, or make you think a little bit different, please follow, subscribe, and leave us a review on your favorite podcast platform. And as always, let us keep asking the question, what about rural health? Until next time, I am still your host, Chinasa Imo. Bye for now.